Have you ever started a new medication and felt different? Maybe you noticed a sensation you can't quite put your finger on, or a shift in your mood or energy that caught you off guard. It's a common experience, especially as we get older and our bodies become more sensitive to changes. Maybe a blood pressure pill leaves you feeling unusually tired, or an antidepressant brings on a dry mouth and a sense of disconnection from your usual self. Sometimes, it's a subtle change, like a lingering headache, or a new ache in your joints, that makes you pause and wonder what's really going on. You might find yourself asking, is this just a normal part of aging, or is it something more? Could it be the medication, or is it simply the stress of daily life catching up with you? For women over 40, these questions are incredibly common. Our bodies are constantly changing and recalibrating, especially during midlife. Hormones fluctuate, metabolism shifts, and what once worked for us may suddenly feel different. It's easy to brush off new symptoms as just another sign of getting older, or to blame them on stress, busy schedules, or lack of sleep. But sometimes, the very medicine that's supposed to help us can introduce new challenges we didn't expect. Women are often expected to power through discomfort, to keep going no matter what. But your body is sending you important signals, signals that deserve your attention and care. Learning to listen to your body is the first step toward real control of your well-being. Keeping a journal of your symptoms, noting when they appear and how they change, can help you and your healthcare provider spot patterns and make informed decisions. Subtle shifts, like changes in digestion, brain fog, or trouble sleeping, can all be linked to how your body processes medications. Sometimes, these changes are easy to overlook, but they can have a big impact on your quality of life. Hormonal fluctuations, changes in metabolism, and even shifts in body composition all play a role in how medications affect you after 40. What worked for you in your 30s may need to be adjusted now. Understanding these changes isn't about fear, it's about empowerment. When you know what to expect, you can advocate for yourself and make choices that support your health and happiness. In this series, we'll explore why your body responds differently to drugs after 40, which medications are most likely to cause side effects, and how you can become an informed, active partner in your healthcare journey. Remember, you have the power to ask questions, to seek second opinions, and to ensure your treatment supports your whole health, not just one symptom or condition. Let's uncover the midlife medication mystery together, support each other, and embrace this chapter with knowledge, confidence, and community. After you turn 40, your body begins to undergo subtle but significant changes that can dramatically affect how you process medications. What once worked seamlessly in your 30s may now feel different, and you might notice new reactions or side effects that never happened before. One of the biggest shifts is hormonal. Levels of estrogen and progesterone start to fluctuate, especially as you approach menopause. These hormones don't just influence mood and energy, they also play a role in how your body metabolizes drugs, impacting everything from your liver's efficiency to your overall sense of well-being. The liver, which acts as your body's main detox organ, may begin to process medications more slowly as you age. This means that drugs can stay in your system longer, sometimes making their effects feel stronger or more prolonged than before. Even medications you've taken for years might suddenly seem more potent or cause unexpected reactions. Your body composition also changes with age. There's often a gradual decrease in muscle mass and an increase in body fat. Since some medications are stored in fat cells, they can linger in your body, potentially amplifying side effects or making it harder to predict how you'll respond. In addition, both your kidneys and liver may work a bit less efficiently than they did in your younger years. This slower clearance means drugs can build up in your system, increasing the risk of side effects or interactions with other medications. Even your sleep patterns and gut health can shift after 40. Poor sleep or changes in your digestive system can affect how your body absorbs and responds to medications, sometimes making them less effective or more unpredictable. The gut microbiome, the community of bacteria living in your digestive tract, also evolves with age. These changes can alter how much of a medication actually enters your bloodstream, affecting its potency and how long it lasts. All these factors combine to create a new internal environment, one that's unique to you and constantly changing as you move through midlife. As a result, medications that once worked perfectly may now feel different, or you might experience new symptoms and side effects. It's not uncommon to need dosage adjustments or even a switch to different medications altogether. Being aware of these changes empowers you to approach your medications with more mindfulness. Tracking your symptoms, keeping a health journal, and communicating openly with your healthcare provider can make a big difference. Remember, it's not about blame or fault. It's about understanding and adapting to your body's evolving needs as you age. Support from friends, family, and your medical team can help you navigate these changes with confidence. In midlife, a more personalized approach to medication is essential. By staying informed and proactive, you can ensure your treatments continue to support your health and well-being for years to come. After the age of 40, you might notice that side effects from medications feel more intense than they used to. What once seemed like a minor inconvenience can now become a daily challenge, making you question whether your body is reacting differently or if it's just your imagination. For example, a sleep aid that once helped you drift off peacefully might now leave you feeling groggy, sluggish, or even disoriented well into the next day. The restful nights you counted on may be replaced by lingering fatigue that affects your mood and productivity. Digestive issues like bloating or nausea, or mental symptoms such as brain fog and forgetfulness, can become more pronounced. This happens because, as we age, our bodies process drugs more slowly. The same medication can stay in your system longer, amplifying its effects and side effects. These changes aren't just in your head, they're your body's way of signaling that its needs have shifted. It's a natural part of aging, and it's important to pay attention to these messages. Experiencing stronger side effects doesn't mean you've failed or done something wrong. Instead, think of them as important messages from your body, letting you know it's time to reassess your approach to medication. These signals are your body's way of telling you that it's time to reevaluate your medications and dosages with your healthcare provider. What worked in your 30s may not be right for you now. The standard dose that once suited you might now be too much. Your body is unique, and as it changes, it needs a more personalized, tailored approach to medication. When starting a new medication, it's wise to begin at the lowest effective dose and increase slowly, always under your doctor's supervision. This careful approach helps minimize side effects and gives your body time to adapt. This start low, go slow method is especially important in midlife, as it allows you to find the right balance without overwhelming your system. Keep track of any new or worsening side effects in a journal, and don't hesitate to reach out to your doctor if something feels off. Advocating for yourself and requesting adjustments is a key part of staying healthy. Recognizing and responding to these changes is essential for safer, more effective care. Your health journey is unique, and your treatment should reflect that. Your midlife body deserves a plan that's as individual as you are, one that takes into account your changing needs, lifestyle, and goals. So, listen closely to what your body is telling you. With awareness and the right support, you can navigate these changes and continue to thrive. Let's look at common medications for women over 40 and how their side effects can intensify. Antidepressants like SSRIs may cause more noticeable weight gain, fatigue, or lower libido as metabolism slows. Hormonal birth control can increase risks like blood clots and high blood pressure, and side effects like mood swings or headaches may worsen. Blood pressure meds and statins can cause dehydration, muscle cramps, or pain, symptoms that can be mistaken for aging. Sleep aids may lead to next-day grogginess, and thyroid medication needs careful adjustment as hormone levels fluctuate. These overlapping symptoms can be confusing. Regular monitoring and open conversations with your provider are crucial. Don't assume every new symptom is just aging. Stay alert to how your body responds. Is your brain fog from perimenopause, a new medication, or just poor sleep? Don't automatically blame aging. Track your symptoms. Keep a simple journal noting energy, mood, sleep, and any new aches or pains. Be specific. Note when symptoms start and if they coincide with medication changes. Patterns may reveal what's really causing your discomfort. Side effects can appear gradually, not just right away. Look back at your health timeline for clues. Challenge the assumption that every new symptom is inevitable. By tracking and questioning, you empower yourself to find real solutions. Your detective work can make all the difference. Many medications quietly deplete essential vitamins and minerals, leading to new symptoms over time. Statins can lower CoQ10, causing fatigue and muscle pain. Diuretics may flush out magnesium and potassium, leading to cramps or irregular heartbeats. Metformin can reduce vitamin B12, causing fatigue and nerve issues. Even birth control pills can lower B vitamins and zinc, affecting mood and immunity. These deficiencies are often mistaken for aging or illness. Understanding this hidden risk lets you take steps to replenish nutrients. Protect your long-term health by staying informed. Your annual medication review is a powerful tool for midlife health. Bring a complete list of all prescriptions, over-the-counter drugs, and supplements to your appointment. Use your symptom journal to discuss any changes or concerns. Ask if each medication is still necessary, if the dose is right, and if there are better options. Don't hesitate to question side effects or ask about nutrient testing. This review ensures your treatment plan evolves with your needs. It's an essential act of self-care and advocacy. Make it a non-negotiable part of your routine. You can support your body while on medication through smart nutrition and lifestyle choices. Help your liver by minimizing alcohol, processed foods, and focusing on cruciferous vegetables and antioxidants. Drink plenty of water to aid detoxification. Support gut health with fiber-rich foods and fermented options like yogurt or sauerkraut. These nourish your microbiome and improve nutrient absorption. If you're on medications known to deplete nutrients, ask for targeted testing. Supplement wisely under medical guidance if deficiencies are found. These steps help counteract side effects and build resilience. Your daily choices matter as much as your prescriptions. Strengthen your foundation for lasting health. Never stop or change a prescribed medication on your own. Abruptly quitting can cause dangerous withdrawal or rebound effects. Some drugs, like antidepressants or blood pressure meds, must be tapered slowly. If you're experiencing side effects, talk to your provider. Use your symptom journal to explain what's happening. Your doctor can help you adjust safely or find alternatives. Think of your provider as a partner in your care. Your experience matters, but medical guidance is essential. Safe changes always require teamwork. Midlife isn't decline, it's recalibration and wisdom. Your body's new sensitivities are invitations to listen and take charge. Understanding how you process medications transforms you into an active participant in your health. Watch for amplified side effects, question new symptoms, and be aware of nutrient depletion. Use your knowledge to ask better questions and track your health. Make annual medication reviews and symptom tracking part of your self-care. Nourish your liver and gut, and request nutrient testing when needed. These steps honor your body's wisdom and support your vitality. You have the power to shape your health journey. Midlife is your opportunity to fine-tune your wellness and reclaim your energy. Step into this chapter as the expert and advocate for your own vibrant life.